Hi, I'm Dr. Chuck from Your Filthy Mouth. How do you get your kids to brush your teeth, and why are baby teeth important? Two things we're going to be talking about today, so stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn. I'm here with Dr. Chuck, and we're here to talk about your filthy mouth, and specifically how your mouth holds the key to your overall health. Yeah. Today, we're going to talk about something that if you've got kids, man, you're going to have to listen to this, because we want to talk about why baby teeth are important and also how to get them to brush their teeth. Yeah. But we want to remind you before we get into the show to subscribe so you don't miss any episodes, because they're amazing and compelling, and they're really important that you share this with your network of family and friends. So go ahead and hit the subscribe. We would really appreciate that. So, Dr. Chuck, how are you today?
Fantastic, Suzanne. Thanks so much.
All right. Well, I'm excited about today's topic because it wasn't that long ago that I was struggling trying to get my kids to brush their teeth. And I guess one of the first questions is, if they're going to lose their baby teeth anyway, why does it matter?
That's a great question. And a lot of parents have that question. Not just a baby tooth.
Right, yeah.
Well, there are three main reasons you want to hang on to those baby teeth. Number one, they're going to maintain the position for the adult tooth that comes in underneath. So if you lose the baby teeth too soon, the adult teeth or the other teeth are going to drift in over there, and you really increase the chances of needing orthodontics or braces later on.
And that's expensive.
That's right. Prevention is a whole lot is a lot better than waiting for there to be a problem.
Yeah.
Okay, so that's one reason you want to maintain the space for the adult tooth that's going to come up where that baby tooth was in the arch.
Okay.
Okay, that's one reason. Another reason is speech development. You know, you need your teeth in there to say certain words. You know how
like your S's.
Your S's, yeah, when you lose your two front teeth, Christmas. And so you need your teeth there for speech development. And the third thing should be the most obvious. We need them for biting and for chewing. And that's why we need to hang on to these baby teeth. They're really important.
So those are all really great, compelling reasons to have your kids brush their teeth and to motivate them to. But how do you take the step of having them brush their teeth? I mean, it's a fight a lot of times.
It can be a fight, or you can figure out what's their hot button.
Okay.
And kids at different age have different hot buttons. So when you've got a youngster in there who's 3, 4, 5, 6, even 7 years old.
What motivates them?
Well, one of the things we tell them, and it's the truth, it's just that we're using different words.
Okay.
Everybody has little bugs in their mouth. We call them sugar bugs.
Okay.
And these sugar bugs go all over the teeth. And when you brush your teeth, the whole idea is you need to get the sugar bugs off your teeth.
Okay.
Because if you don't, when you're sleeping, the sugar bugs go poop all over your teeth.
No.
And this poop is, if you ever wake up in the morning and your mouth kind of funny, that's sugar bug poop. So you've got to go in, you've got to brush your teeth really good. You got to get the sugar bugs off of your teeth before you go to bed at night. You know, and kids don't want sugar bug poop in their mouth, so it's a motivator. Is it the truth? Absolutely. We've got bacteria on the teeth that have byproduct, lactic acid, and some other things that demineralize the tooth and cause periodontal disease. So those are bigger words, but kids don't get that. They understand poop.
And it's actually worked. I mean, you're seeing results.
Oh, my gosh, yes. In fact, I have parents tell me, what did you tell them? I just spoke their language, you know.
Oh, that's great.
Yeah.
That's very cool.
So they understand. It's like they don't want that stuff in their mouth.
Sure.
You know. So, but when you get a little bit older, something else motivates them. You know, it's sometimes a sex appeal. You know, when you get into high school, you want to have that. And how many people... one of the first things girls look at is guys smile.
Absolutely.
You know, and if you've got rotten teeth in there, if you've got bacteria, you've got plaque, you've got tar all over your teeth.
That's not a kissable mouth.
No. Well, one of the things I suggest when I'm talking to the high schools is before we start kissing somebody, look in their mouth, because if they've got a bunch of cavities in there and you two start swapping spit, guess what? They're going to have, you're going to have the same bacteria that's causing their problem. So you're going to share a whole lot more than a kiss with that person. So, you don't realize that's one way it's passed.
So it's really just talking the language of who you're speaking to and knowing what motivates them.
And for elderly people, and I'm going to put myself in that category right now, it's a health factor. So if you understand just how important the bacteria, to remove the bacteria from your teeth are for your overall health, that health becomes more important the older you get. Have you noticed that?
Yes, have noticed that, yes.
And you don't take it for granted. And you realize you've got to spend that 5 to 7 minutes every day cleaning your teeth really good, for your heart, for your brain, for a whole lot of your body.
Wow.
So that's different motivations for different ages. But for kids, sugar bugs and sugar bug poop, that's fantastic.
All right, we're going to be back with the question of the week. Don't go anywhere.
Here's Dr. Chuck's question of the week.
Dr. Chuck, today's question of the week comes from Kelly, and you talk often about disclosing tablets,
Yep.
the things that turn your teeth, pink and purple if you don't brush well.
Yeah.
She wants to know, what's the importance of that?
You don't know what you don't know, and that's a big deal, right? The plaque is the same color as your teeth. So when you brush your teeth, when you floss your teeth, and you look in the mirror and you think it's all clean, it may look good to you, but that doesn't mean that you got the bacteria off your teeth. I'm becoming more passionate with this the older I become. If oral disease is one of the biggest causes of so many of our systemic problems, or a big factor in it, then what's the cause of oral disease? Well, it's the bacteria in the mouth that we have. If we've been so removing it for all of our lives, let's see if we can up it a little bit. Well, the way you up it is you have to identify what you're missing. You have to grade yourself. And that's why the disclosing tablets are so good, because you can grade yourself.
Right.
Rather than just thinking you've done a great job, now you can look in there and say, okay, I missed here. And I've told many of my patients, the first time I used disclosing tablets, I swore I had a defective tablet. It marked way too many places. There's no way I missed those places, I went back, and sure enough, it did brush off. And it's like, oh my goodness. So I'm not hung up on technique. And that's the one thing I want people to really take away is it doesn't matter on your technique. It matters on your results. The whole idea is to remove the bacteria from your teeth without damaging the tooth or the gums. Now, you can use manual toothbrush, electric. I prefer electric because I think it does a better job. Whoops. You can use floss. You can use water irrigation. You can use these little picks that go right in between your teeth. It doesn't.
Just do it.
Just do it,
Right.
and then grade yourself with the disclosing tablets afterwards. Then you can find out, did I do a good job or am I fooling myself?
Kelly, great question. Matter of fact, if we use your question on Your Filthy Mouth, we'll send you something.
Absolutely.
Absolutely. Let's order some coffee mugs or something for our friends that write in.
I think that's in the works.
All right,
we got some coffee mugs.
Yes. Go to Your Filthy Mouth. You can actually just click the button and speak the question in, and boom, if we use you, you're famous. And you get a great coffee mug that we haven't ordered yet. So.
It'll be here.
Yeah. Okay, Dr. Chuck, so today we talked about the importance of keeping your kids' baby teeth nice and clean and how to get them to clean. What are the 3 takeaways for today?
Number 1, you need to hang on to the baby teeth so that you can maintain the position for the adult teeth when they want to come up. Number 2, we need the teeth in there for chewing because you need to be able to chew your food on that. And number 3, you need it for speech development. You need to be able to have the teeth in there so that you can learn how to talk properly.
We want you to share this information, your network of friends and family. That's what we're trying to do. You're not claiming to be the expert. You're asking for people to take this information and
No,
research
I'm
more,
a messenger. I'm not the expert. If you go to our page and click on the links, you can go to the experts and find out exactly what they have to say. But I'm just a messenger. I'm here to give you information.
So if you're interested in purchasing some of Dr. Chuck's favorite dental hygiene items, we talked about disclosing tablets today in the question of the week from Kelly, you can go to yourfilthymouth.com. Ask questions there, find lots of great information, and the most important thing, we'll see you next week, okay?
Have a great day.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.